Going back to the volume that I mentioned earlier, Sculptra is a wonderful product. Sculptra actually stimulates your body to make its own collagen. So if you're in, the classic patient for Sculptra is probably at least past their 40th birthday, maybe into their 50s. They're getting a little bit more of a hollow face in the temples, cheekbone area, and Sculptra can begin to stimulate your body to make its own collagen to bring back a more rounded, more youthful face.
Is that something, some of these procedures, are they just like one day you go in for, like how much time does a procedure like that take? Like
yeah, these are definitely just office visits. I mean, the whole thing, check in to check out, is probably under an hour. If you're doing Botox or a Dysport, a muscle relaxant, you're going to want to do that about 3 to 4 times a year just to maintain it. Sculptra is done in sessions, and so a typical Sculptra patient would probably make about 3 office visits over a 2-month period to get the collagen stimulation, to get the rounder cheeks, filled out face, those types of things. So it's not just one treatment, but after 2 or 3 office visits, you're going to be pretty much where you would like to be.
Okay. And I know that there are some people, I think a small percentage, that feel like, oh, I'd like to get this done, but is it safe, completely safe?
Nothing has no risks, and particularly in plastic surgery, there's always going to be some risks. Of course. The goal, hopefully, for people watching is do your research and find somebody who does a lot of this stuff, not just dabbles in it. And so the main risk with these things, for example, let's say Botox, the muscle relaxant, if you treat too much, you might get a little bit of a droopy eyebrow. That may last you 6 weeks. It will go away. Sculptra has a few side effects. They're pretty uncommon. For the most part, having done many, many injections over the last several years, I've seen very few long-term problems with it. It's a good volumizer. It can be done in the office, keep you out of the operating room, and adds a very natural look to the face without the downtime of a surgical procedure. Okay,
and kind of going off what you said, going with a provider or doctor that knows what they're doing, that's been in the practice for a while, like yourself, what would you recommend to people when they're researching who to go through for?
We're pretty fortunate. I mean, for a smaller community, we actually have a lot of good providers. So one nice thing about the cosmetic world for patients is there is a competition online for recruiting new customers, if you will, new patients. And so most people can go online and research their provider. Of course, I'm biased. I like to see people who've dedicated their lives to a cosmetic surgery discipline. So when I see people in other medical specialties dabbling in cosmetics, I get concerned. Probably not the people I'd want to send my wife to. But people can do their own research. We have a diverse community of providers. My bias is to stick to people who've dedicated their careers to cosmetic surgery. Facial plastic surgeons, dermatologists, people who really practice it full-time, not just dabble in it.